Howdy y'all, in this video today, in today's Poop Tip Tuesday, we're going to go over a couple different things. Number one, I'm going to give you my advice on how you can handle everything that's going on in the world. The election, the stress, COVID-19, these are my recommendations I have found to be helpful for me. Number two, we'll talk about exactly what happens when you hold in your poop. Do you explode? Do you have gut issues? Is this something bad? Here are my thoughts on that. Number three, we'll talk about what is the difference between a food allergy and a food intolerance. Very significant difference, which can really confuse a lot of people. Number four, we'll talk about what is cirrhosis and what are some complications from that. And number five, I'll answer the question, do you have to poop every single day? So those guys who are joining for the first time, my name is Dr. Islam, and yes, I'm an actual poop doctor. My passion is to give you guys the best tips and tricks to help out with your health. Every Tuesday around this time, I would do a Poop Tip Tuesday where I go into questions. You guys have asked me questions, you either DM'd me, questions you send me via email, or ask me in the clinic. At any point in time in the video, click down below and let me know if you have a question. I can answer that towards the very end of the Poop Tip Tuesday. And importantly for me, let me know if you're watching this live and on the replay. And also let me know if you're watching this in town in Lubbock or somewhere outside. I hope you guys are having a happy and safe week. The weather is fantastic. I just came back from a long walk. I had a really good time. So a couple of announcements. Number one, if you haven't already, don't forget to subscribe to a weekly newsletter. Number two, if you haven't already, don't forget to smash that like button. Like, share, and subscribe so other people can know exactly what's going on. I am so excited to still announce that we're opening up a new clinic starting in January 2021, 4505 82nd Street, Suite 5 and Suite 6. Our new website is lubbockgastro.com. Don't worry, if you are a patient of mine, you are still going to see me. I would love to continue that relationship with you. I am still having every single insurance that you're used to, and I'm expanding my insurance to include Covenant, First Care, and pretty much every other insurance that's out there. So if you want to see me, I would love to see you. Set an appointment, have your PCP set up the referrals to me, and let me know exactly what we can do to get you taken care of. Heath, it is good seeing you. Great question. I will answer that question very soon. Mary, it's good seeing you as well. Michelle, it's good seeing you. Thank you guys for watching, and thank you, Mary, on the new clinic. I'm excited to have that. We are very excited. So let's talk about the first thing. My first question I got. I thought about this week. So I had a patient ask me, hey, Dr. Islam, how are you handling everything that's going on with the news, the election, COVID-19, all the stress that's going on? How are you handling that? I will tell you, this is a very stressful time for anyone living in the world with things going on with COVID-19, obviously the pandemic, the stress from that, the worry about you getting sick, things going on in the election, no matter what side of the coin you're on, you are stressed about what could be going on, some of the results from that as well. And also other things that could be going on, in your life, whether it's more stress because you're sitting at home, maybe you're stressed, some other things going on, and other problems going on inside your everyday life. So here are my basic tips on what you can do, because I really do feel like what you are getting stressed about is basically what you're seeing on the news and social media. Keep in mind, the news and social media really do a very good job of getting you hooked emotionally about what is going on, and really gets you either fired up towards one way or towards another way. That is the whole goal of using social media, is to get you on those platforms as long as you can. Obviously, I know it's very ironic. I'm doing this video on a social media platform, but I'm trying to give you more education for this. But I'm trying to help my patients out mentally for what is going on. And so I have found for me what I have done to help me kind of minimize the stress I have had from what is going on is to really limit significantly my input from what I'm using for some of these social media devices, especially when it comes to getting news and getting information about the world. Here are my 3 tips that I recommend. Number one, I would really limit your news consumption to maybe 10 or 15 minutes in the morning from a trusted news site that you use, whether it's a newspaper, whether it's a podcast that has a summary of all the big news, whether it's a news channel or a website. I would not use social media as the barometric measure of what is going on in the world, because keep in mind, the social media algorithms are tailored to give you content that's going to make you more excited, more stressed, more engaged with the content, so you keep on flipping to see exactly what's going on. But I would really limit it to just that time in the morning, and that's basically it. Number two, I would make sure you don't use the social media sources as your main avenue of getting news. Use a news website that you like, that gives you good news that you're happy with. Use a podcast channel. Use a newspaper. Yes, people actually use those. They're still around these times. And also number three, don't look at the news anymore throughout the day. I can tell you, if you are not a news anchor, if you're not a news producer, you're not going to be breaking any news. You don't need to be on top of the news all the time. And I really have found that for me, this has been very therapeutic to keep me less engaged for what's going on things that I cannot control. It also allows me to focus on the things that I can control. And I found that for me, this has been a very effective deep reset to make me less anxious about what is going on in the world. And so I think this would be a helpful thing for all of my patients to do. Michelle, it's good seeing you, and Sylvia, it's good seeing you, and Mr. Newbie, it's good seeing you guys as well. So let's go to question number 2. I got this from a question that a patient asked me today. Hey, Dr. Islam, what happens when you hold your poop? So let me know in the comments down below. I'm not going to ask you if you've done this, but let me know in the comments, what do you guys think can happen if you hold on to your poop for such a long time? Does your colon explode? Do you get a lot of gut issues? Is it even bad? Does it become toxic for you? Let me know in the comments. I'm really curious to see what you guys have to say about that. Because I will tell you that whenever you do hold in your poop, there are a couple of things that can occur to you which may not be the best thing for you. Number 1 is that whenever you do hold in your poop, this gives your body the sensation that, hey, if I do feel the need to go, but I don't go, I am actually not going to use the restroom. And Michelle, you're exactly right. It makes you constipated. That's exactly right. And the problem is that your body gets used to the feeling of not responding to the urge to go. And that can really make it more difficult for you to have bowel issues. And this is really why you can have really bad stomach pain. Marie, it's a very great point. You're exactly right. You'll have very terrible stomach pain. And the problem becomes that as your body gets adapted to not responding to the needs of you using the restroom, you'll start to not actually use the restroom. You'll develop a condition called pelvic floor dysfunction, in which the rectum muscles are not working correctly at all. And because they're not working correctly, this will make it even more difficult for you to use the restroom. And so one of the basic things that we recommend whenever we're having somebody help out with their constipation is to train themselves to use the restroom every single day at the exact same time if you can. Even if you don't use the restroom at that time, if you go, hey, if your body knows, hey, I use the restroom every time at 7 o'clock in the morning, your body will get used to that rhythm, and that rhythm will allow you to have more effective bowel habits. If you break up that rhythm, or if you hold in that bowel movement and not actually use the restroom, your body will get to the idea that, okay, I may feel the urge to go, but I know that I'm not going to go, so I'm not going to feel that urge anymore, so I'm just going to keep things in. A couple things that will not happen, so you will not develop toxins in your body. There really is nothing pathologic about having stool inside your colon, except for you will develop severe abdominal pain, and you certainly will become constipated as well. So big summary is that if you have to use the restroom, use the restroom. Don't make it a habit of holding it in, because that will develop the habit of actually not using the restroom at all. Cruz, is good seeing you. Thank you for watching. And Nelly, good seeing you as well. And I'll answer that question, and we'll go from there. All right, perfect. All right, question number 3. I got this question from a DM who asked me, a DM on Instagram, who asked me, hey, Dr. Islam, what is the difference between a food allergy and a food intolerance? So I'm curious, have you guys heard of this? Have you guys heard of a food allergy? Have you heard of a food intolerance? Have you been told you have a food allergy, but then you see this allergy list, you see a whole bunch of foods, you can't eat them, then you're wondering, okay, what can I eat? Or what actually happens when you have a food allergy? Or what happens when you have a food intolerance? Very common question that I get. I'm curious to hear what you guys have to say about that, or what you guys think about that, or whether you think this actually may be something that you've heard about. So here's kind of the gist of the story. A food allergen is an actual allergic response that you have to eating food. You actually have a physiological response in which you have the allergen cells attack your body when you ingest those foods. And that can manifest in a lot of different ways. Hives, for example, shortness of breath, choking, itching skin, feeling sweaty, having an actual allergic reaction that actually happens when you have a food allergy. These are tests that we can check for by doing a skin prick test. A skin prick test does a very good job of telling you what a food allergy is. And when you have an allergy, like a peanut allergy, you'll actually have an allergic response to that. Now, Very, very, very different from a food intolerance. So a food intolerance is something that you cannot test for. No one can test for. They may put out these kits that are out there. They say, hey, we can determine exactly what you are intolerant to. Guess what? Those kits make no sense whatsoever. It is a waste of your time and it's a waste of your money. And my goal as your poop guru is to give you the accurate information so you don't waste your time and waste your money. There is no benefit at all with getting a food intolerance test. Now, a lot of people have food intolerances. So, for example, gluten is a very common food intolerance. Milk is a very common food intolerance. Fructose is a very common food intolerance. We typically cannot test for some of these conditions, but your body will manifest those symptoms as bloating, distension, abdominal pain, getting very, very big, a lot of gas. But there is no direct test for a food intolerance. So you may be intolerant to gluten, but unless you actually have the autoimmune condition called celiac disease, we cannot test for that, no matter what food allergen that you have. And this is the big difference because a lot of people have these intolerances and they have gut issues, but it's very different from an actual allergy in which it can manifest as hives and things like that. All right, perfect. All right. So Sylvia, you bring up a very good question. You have a friend that goes to the bathroom every 5 days and only on her days off. And we'll talk about exactly what that could mean and what's going on with that. Very good comment on there. All right, so question number 4. I actually had this patient come in to see me last week who said, hey, Dr. Islam, I have been told that I have cirrhosis. What is that? And what are some of the long-term complications from that? So cirrhosis is whenever you have scarring of the liver. There are a couple of different stages of scarring or fibrosis that we have. And whenever you have stage 4 fibrosis or scarring, that's when you actually have scarring all over the liver. Now, before you hit stage 4, you have the opportunity to reverse what's going on in your liver. The liver does a very good job of reversing some of the damage you may be having, whether it's from alcohol, whether it's from herbal medications, one of the more common causes for liver disease, whether it's from fatty liver disease, whether it's other complications. Your liver does a fantastic job of being able to reverse back to normal if you get rid of the toxin that's causing it to be injured. Once you hit stage 4, though, that's when actually you have scarring over your liver, very much like a scab that you have over a cut. And when that scarring occurs, that is not reversible, and that's when you get to cirrhosis. Now, when you have cirrhosis, there are different grades of how bad the cirrhosis is. We use a score called the MELD score or the CTP score to allow us to determine what the score of your liver is doing whenever you are cirrhotic. And based on that, we can determine how severe your liver may be. So once you have cirrhosis, the ship has already left the shore. You really can't go back beyond that. But I can tell you, we can help manage your cirrhosis to make sure it doesn't get any worse. Now, there are a couple of complications that can occur whenever you have cirrhosis that you have to be aware of. Number 1, so you can develop what's called ascites, which is fluid around this belly. Your liver is made to help produce protein, and whenever you have cirrhosis, you have the inability to produce enough protein, and when you have lack of protein, you have a significant amount of fluid around the belly. Now, fluid can either be drained by putting a needle in there and removing that fluid, or we can give you medications that pee out that fluid. It's the first complication. The second complication is a condition called hepatic encephalopathy, which is confusion because of the buildup of the toxins inside your body. So your liver's function is to help get rid of toxins and remove those toxins. If the liver is scarred over, you cannot remove those toxins. They can build up and cause people to be confused, have problems with sleeping. Maybe they have a reverse sleep-wake cycle. They are awake all night and sleep during the day. They may not remember things that are going on. They may have difficulty driving. And one of the ways that we can treat that is we help you poop out the toxins by giving you medication to make you poop a lot more. A third complication is that you can develop what are called varices or dilated veins inside the esophagus. So just like varicose veins in the leg, you can have the same veins inside the esophagus because of the scarring that's causing backflow of blood up into the esophagus. And the biggest significant risk factor for varices is that they can cause significant bleeding or vomiting of blood. And unfortunately, this is a complication that can occur for anybody who has cirrhosis. And then lastly, irregardless of how your cirrhosis is, there is a chance of you developing liver cancer. And this can happen no matter how well we treat the cirrhosis, or no matter how well we treat the liver. And this is why typically we'll get imaging and blood testing every 3 to 6 months for anybody who has cirrhosis, so we can keep an eye on the liver and we can catch we can catch the possibility of developing liver cancer early and potentially treat you before it becomes a significant problem. So unfortunately, cirrhosis is a very common condition. The most common reason for cirrhosis currently is fatty liver disease. In the past, it used to be hepatitis C and even alcohol, but now the number one cause, can you believe it, is fat that accumulates in the liver. All right, perfect. And then lastly, question number 5, before I answer your live questions, do you have to poop every single day? So guys, let me know what you think. Do you think that you have to poop every single day? Let me know in the comments down below. Do you feel like it's important to poop every single day? Do you think it's normal to poop every single day? Do you think if you poop every single day that you technically are not constipated and things are doing well? I'm really curious. Let me know what you guys think in the comments below, because I can tell you that for me, it does not matter at all if you poop every single day. Yes, I said it. I gave you permission to not poop every single day. And so the frequency of how often you go to the restroom does not correlate at all to if you're constipated or not. It's not a big deal. And so pooping every single day should not be a goal for everyone to go, because that's normal, but who cares? It's not a big deal. Can you believe that there are plenty of patients who poop every single day who are still constipated? Absolutely. They may not get a complete bowel movement. And so the best analogy I have is, let's say you're using the restroom, you get 70% of your bowel movement out, but you still have 30% that's in there. Your whole goal when you use the restroom is not to keep that 30%. And so you still are constipated, and 30% will add on to whatever stool you have left in there and produce more and more bowel habits. This is why there are people who use the restroom every single day but are still constipated. Can you believe that? They have incomplete evacuation. They're not getting everything out. They're not pooping everything. But I have other patients that poop once every 3 or 4 days, maybe once a week, and they feel perfectly fine. They don't have any pain. They don't have any issues. So those patients, I don't even worry about it. The big issue with constipation is, how do you feel when you use the restroom? If you go once a week, but you feel perfectly fine, you don't have any pain, and you're happy with that, boom, all good. I am happy with that. But if you go every single day, and despite going every single day, you're struggling, you're pushing, you're straining, you're not having good bowel movements, guess what? You are constipated despite going to the restroom every single day. So your goal when you have a bowel movement is to not go every day, because that's not a big deal. Your goal is to have a happy bowel movement, to have a good bowel movement, and to be, oh yes, that is an awesome bowel movement. That's the goal that I want for you guys when you use the restroom. Guys, I want to thank you for watching today. I appreciate it. So I want to answer some of the live questions. So Marie, you had a very good question about anal fissure. Let's talk about it. Let's talk about it today. So anal fissures, let's talk about this. So anal fissures are a tear in the rectum that's very common from straining and pushing or being constipated. And your rectum is a very sensitive area that can very easily cause damage or bleeding, especially if you have to push a lot in your bottom. And it can present as severe pain in the bottom, almost like a knife-like pain in your bottom, also associated with bleeding as well. Now, there are a couple things that we can do to help out with an anal fissure. Number one, we have to make sure your bowel movements are soft and you're not straining. So consider adding some fiber. Consider adding some water, maybe a stool softener, or even some Miralax. Number two, there are some creams that we can give to help out with the pain and to help heal up the fissure. Sometimes we give a nitroglycerin cream. Sometimes we'll give a lidocaine cream. Sometimes we'll give a different type of cream to help with that spasm and that tear that's there. For other people, we actually may inject Botox. Yes, the same Botox we use on your face, we actually can use it in your bottom to relax those muscles, to allow those muscles to heal. And then lastly, surgery may be an option as well for people who have a fissure. So we have all these options that are there to help control those symptoms. And obviously, once we can control those symptoms, there's a very good chance that the fissure will not come back. All right. So Nelly, I'm going to answer this question. So how do we get our body in the habit of going every single day? So here's what I'm going to recommend for you. So it's a pretty big topic in terms of how to deal with constipation. So I will tell you, number one, I would recommend you use the restroom every single time, every single day at the same time. So for example, make yourself use the restroom at 7 o'clock in the morning. Stay there for maybe about a minute or two. Even if you don't go to the restroom, your body at some point in time will get used to that rhythm of you being consistent with using the restroom at this point in time. So find a direct time that's good for your schedule where you can train your body to use the restroom. Your body will tell you. I'm sure there's been some times in the past where you know, hey, I used to go every morning. Keep on that habit and don't change that habit. Number two, if you feel the urge to go even beyond that time, use the restroom, because you holding your bowel movement in is going to make it more difficult for you to have that to make it more difficult for your body to be trained to use the restroom more effectively. And number three, try to do some techniques to help you use the restroom whenever you do use, whether it's a squatty potty, raising up your knees, deep breathing, doing some massages to push things through. These are actually very effective ways to allow you to help out with constipation. And there are other things that we can recommend. I have a lot of videos on natural options for constipation and other things to help out with constipation if you want to check out my Facebook page and my YouTube channel as well. That's a very good question, Ellie. All right. Okay, so Heath, good question. That's a great question. So Heath, you got a question. Why do you poop more than once in the morning? So a very good question. A couple of different reasons why I can answer that, why that's the case. So number one, keep in mind that whenever you're using the restroom in the morning, you're building up all the stool that is occurring and accumulating from your dinner time up until that morning. So it's at least 8 to 10 hours. So during that time, even though you're asleep, your body is still moving things through in the morning for those 8 hours. Number two, if you drink coffee in the morning, or caffeine, those are both stimulants for your GI tract. So that will allow you to actually have a bowel movement. So it's not surprising that when you do that in the morning, because whenever you drink coffee or tea or have some sort of caffeine, it helps move things through. Number three is that a hot drink also acts as a stimulant for your GI tract to wake it up. It's called the gastrocolic reflex to allow things to go through. Number four, eating breakfast as well stimulates your gut. It lets your gut know, hey, I am waking up. It contracts that gastrocolic reflex to move things through to have you have an effective bowel habit. So these are the reasons why you go to the restroom a lot earlier in the morning. Yeah, and Sylvia, you're exactly right. Coffee is a stimulant. It allows you to use the restroom a lot easier. It also allows you to have a good bowel movement. Perfect. Great question. All right, guys. Want to thank you for watching today. If you haven't already, don't forget to smash that like button, share, and subscribe. Tune in next Tuesday. We're all going to more questions. If you have a question for me, I would encourage you to subscribe to a weekly newsletter. Send me a DM, send me a message. I get these messages. I'll scroll through them, and I'll see if I can answer any more questions on future Poop Tip Tuesdays. Hope you guys have a happy and healthy day. Take care, everyone.